each time. Look at that. I mean, we're in one of the toughest places that this state has ever been in terms of losing people in the winter. The miracle of vaccines put us in the right direction. We had week after week after week of decreasing cases. But the deadly mixture of the variant plus those who have not been vaccinated is leading to a significant surge in cases that, as you look at, I mean, we got to go all the way back to March. The last 3 weeks, these are reported number of cases, not when we audit them and go back and remove duplicates. 3 weeks ago, 1,844 announced cases. Week after that, 3,217 cases. This last week, 5,000, the announced cases, 662 cases. These are the audited numbers. When we go back, remove duplicates, you can see how quickly it is. The speed of escalation is also the concern. Remember when we were always concerned about an exponential increase? We are not there yet, but we are seeing tripling in some instances in 2 week spans, and the growth. And again, this line gets more and more and more severe each week. Now, though, the line, the trend that truly shows it is the positivity rate. Remember, this took a week or two to change in such dramatic fashion. We have now had 30 straight days of an increasing positivity rate. Now, we got down to under 2%. Yet, look at where we are today. We're getting real close to getting up to 8%, which is not what we want to see, especially when at this point we ought to virtually assume that anybody who tests positive for COVID has the Delta variant and therefore has, in the course of this pandemic, the most dangerous variant that we have seen. Again, new cases are being driven by the unvaccinated. While, if you can show the line chart, Kenneth, we got Kenneth back. Good to have him here. That is the blue line on the bottom. Listen, a more aggressive variant is going to have a little bit more breakthrough. This doesn't talk about outcomes, but the unvaccinated is the diagonal line going up really quickly. That shows you that the vast majority of new cases, and certainly what is truly driving this growth, is a mixture of unvaccinated Kentuckians and a deadly, aggressive variant. Even when we look at today's cases, when we look at the incident rates by age group, the 80 plus is the lowest significantly. That is the most vaccinated. You know, that incident rate is just 8.07. 20 to 49-year-olds, 3 times higher, 23.87. 10 to 19-year-olds, almost 3 times higher, 20.55. And then when you look at the second group that is most vaccinated, and we'll go through age groups, 50 to 79, you know, that is the second lowest, though it is certainly getting higher. So no matter how we look at it, no matter how we break it down, whether it's incident rate, whether it's cases, whether it's the rest, this is an escalation that is happening primarily in unvaccinated Kentuckians, and the solution remains the same. Get vaccinated. We will and we would beat the Delta variant almost immediately if everybody would get vaccinated. Of concern, we are now seeing, and just like we had seen the growth in cases and positivity rate, we can absolutely see a trend in hospitalizations. I think that's, Dr. Stack will talk about this later, nearly tripled in 3 weeks. Same line you see in the ICU. In fact, it's a little more severe than this one. Look at how quickly it's happening. And people in the ICU are really sick. That's how you get to the ICU. I think this shows you that the Delta variant is more aggressive. And finally, COVID-19 patients on a ventilator. You know, tragically, that one also increasing. This would suggest that we're going to see more people pass away than we have seen, at least in the recent past. We've got our numbers down to 2, 3, 4 a day, and I wanted them to get to 0. But grateful that they had gone from those very difficult weeks and months down to that level. Our concern now is that it will grow. Vaccinations. We continue to work as hard as we can every day. Now 2,278,834 Kentuckians have received at least their first shot of hope. Dr. Stack's going to talk a little bit later about the fact that originally there were some, I even think Gottlieb talked about, if you haven't been vaccinated and if you haven't had COVID, you're going to get the Delta variant and it's going to be the sickest you've ever been. We are now seeing a higher reinfection rate because of the Delta variant. In other words, if you've had COVID in the past, this is the time that you are most likely to get it again, and it's going to be worse. So if you have had COVID, and that is the reason you are not getting vaccinated, the data is starting to show you need to get vaccinated. Let's provide a little bit of hope. We've been averaging about 25,000 vaccinations a week in the past month or more. We had a little over 30,599 in this last week. Let's hope that that's a trend, whether that is people being nervous, and you rightfully should be if you're not vaccinated, or other means that are pushing people to get vaccinated. Let's go through our age groups and the level of vaccination. Total hadn't moved. It's still at 62% for those 18 and older. If we can go ahead and show that animation, Kenneth. There we go. 2 age groups doing the best, 65 and up. That's why the incident rate is the lowest. We're still showing 83 in our data. The CDC is showing 86. That's really good, but that also means in that number there's 17% of people out there that are the most at risk, and we still need to get them vaccinated. 50 to 64 went up a point, now at 66%. 2/3 of all Kentuckians 50 to 64 now vaccinated. 40 to 49 still at just 52%. This is my group. We all need to do better. 30 to 39 went up 1%. This is a group that we're starting to see in the hospital more because of the Delta variant. 18 to 29 still at 36%, just over a third, which is going to be part of what drives a number of decisions that I think that we will make, or recommendations that we will make. Let's look at counties first. Remember, this is hitting age groups, if you're not vaccinated enough, and it will hit areas where people aren't vaccinated enough. So this gives you the demographic breakdown. Let's look at the geographic breakdown again. Let's start with Kentucky counties over 50%. New to the graph, Anderson County. That's good work. Keep it up. We want to recognize you when you come over these thresholds. But folks, this is just half the people you'd run into have been vaccinated. We do have a handful of counties that are now over 2/3 of everybody vaccinated. When you think about 11 and under not being eligible, that's really good work. Again, keep it up. Now, counties just over 40% versus under. Again, these are counties in the purple where a person that you meet is less likely to be vaccinated than vaccinated. There is a chance, more likely, the person you're interacting with is unvaccinated because less than 40% of the population is. But counties that have now moved over 40%, since we showed it last week, Muhlenberg, Bullitt, Lee, Montgomery, and Harrison. Good work. Let's get past the 50%, and let's keep going from there. All right, that brings us to one major thing that we are doing today, and that's to give clear recommendations, strong recommendations to our school systems for the year that's about to come up. But I want to start with what our priority should be. Our priority is not to argue with each other. Our priority is not to play politics. Our priority isn't to do some red or blue thing or get involved in some ridiculous so-called culture war. Here's our priority. It's our kids, and it is having them in class every day. It has to be the priority. How we make decisions has to come from one simple place. What gives us the best chance to have our kids in school the maximum number of days in the midst of a pandemic? That is it, folks. That should be our North Star. That should be what drives us. And that should make many of these decisions a lot easier than we want to cast it or describe it. So if that is our priority, what's our challenge? Our challenge is that the Delta variant spreads so quickly that if we are not careful, certainly you look at kids under 12, I think can spread through a room of unvaccinated individuals faster than ever before. Dr. Stack will talk about the viral load and how it is dramatically larger with the Delta variant. And that means that it would spread not only in rooms, but through schools at a rate that by the time you found out about it would lead to significant quarantines, regular quarantines, large quarantines. And remember, if you got a class of 20 kids and one test positive and you don't have the mitigation steps that you need in place, you're going to have a lot of kids quarantined. And when they come back, if any one of the other kids test positive from anything they did in or out of school, you are going to have the frequent and the large quarantines. So what is the expectation? If we don't take mitigation efforts, if school districts don't embrace mitigation efforts, we are not going to be in school every day. And it's not because of anything that I'm doing. It's because the Delta variant is going to stop you from ultimately having your students in like you want to. So with that, today we have what I believe are three pretty clear recommendations to our school systems, our school districts. First, school districts should require all unvaccinated students and any unvaccinated adults to wear a mask when in classrooms or other indoor school settings. The way the Delta variant is spreading, if our goal is to have our kids in class the maximum number of days, this is a no-brainer. Second, school districts should require all students under 12 years of age to wear a mask when in classrooms and other outdoor school settings. Listen, that's part of the first one. I get that because they can't be vaccinated. But to have an entire classroom of kids in the midst of the Delta variant that can't be vaccinated, not wearing a mask, means you're not going to get many in-person school days. And third, school districts that want to optimize the number of days, the likelihood that they will be in person without any outbreaks, without large quarantines. If you want to optimize that, then you should consider universal masking, both unvaccinated and vaccinated. I think these are pretty clear. The science points to them. It's all about the priority. If we truly want as many in-person classroom days, these are steps that school districts will need to take. And we're also already seeing amongst youth more clusters and types of clusters that we would otherwise see in classrooms of unvaccinated individuals, whether that is youth sports, summer camps, high school sports, and or school summer enrichment programs. We are seeing that the Delta variant causes these types of clusters. We're here today with the United Front, wanting to make sure that the education community hears us loud and clear. So your next speaker is Commissioner Glass.
Thank you, Governor Beshear. And on behalf of the education community, we're grateful for your continued efforts and your leadership aimed at keeping our schools open for in-person learning this fall. I'd like to take just a moment to speak directly to our district and school leaders, our staff members, and to our students and families. First, to our district and school leaders. I know that you've been under extraordinary pressure this past year in trying to keep learning going while also keeping your school safe. You've had to execute school operations and virus mitigation efforts on an issue where finding consensus has been nearly impossible. Nevertheless, you've answered the call to leadership by making the difficult decisions and being guided by science in the best interests of your students and your communities. As we look to this fall, we're going to need your courage and leadership once again to put in place the necessary precautions based on guidance from the Centers for Disease Control and our Kentucky Department of Public Health, to keep in-person learning going and to keep your students, staff, and community safe. To Kentucky's teachers and staff members working in and supporting our schools, you've been on the very front lines battling this virus from the beginning. I know that you're tired, and all of us want this to be behind us. But we need to call again upon your professionalism and dedication to continue many of those same mitigation efforts from this past spring to keep our schools open and safe for in-person learning. You've already proven and shown what many thought was impossible in keeping schools open and keeping them safe. And we're going to need that same effort once again going into this fall's reopening of schools. And to our students and families, at the outset of this pandemic, many believed that you could not or you would not be able to follow the precautions, including masking, that were necessary for safe in-person learning. Well, I'm proud of our students for proving all of the critics wrong and showing your commitment to being in school and to keeping your classmates, your school staff, and your community safe. We're going to need that ongoing commitment as we continue to navigate our way through this resurgence of the virus. And I'm counting on you to once again prove the doubters wrong and to show what our young people in Kentucky are capable of. Those working in and learning in our schools know what to do to keep in-person learning going and to do so safely. We've already definitively proven that. Now, as conditions have shifted again with the rise of the Delta variant and reinfections, we need to call once again upon your courage, your dedication, your commitment to keep our schools open for learning this fall. Now I'd like to bring up Board Chair Lou Young.
Good afternoon. Thank you, Commissioner Glass. And I'd like to echo thanks to Governor Beshear, to Lieutenant Governor Jacqueline Coleman, and to Dr. Stack and Dr. White, who have been abiding partners for schools across this Commonwealth throughout the challenges that we faced month in and month out with this pandemic. We appreciate that steadfast leadership and the support that you've provided for Kentucky schools, including being here again today. I'd like to speak for just a moment to elected school board officials across the Commonwealth in our 171 school districts. First, thank you, school board members, for consistently rising to the challenges that we faced throughout this pandemic. You have maintained a laser-like focus on the best interests of safety and health of the children in our school districts, and you've proven, as Dr. Glass said, that we can put these kinds of return to school guidelines in place successfully in our schools. Thank you for those efforts, and I just want to encourage you to redouble those efforts as we think about getting back to school this fall. As you've heard today, our priority is to return to in-person school, but it's also to stay in school. So as we think about this new highly transmissible Delta variant and the potential impact it has on unvaccinated children and youth, it becomes essential that we work together to make every effort to ensure that while in school, our students are as safe from the transmission as they can possibly be. This past year, we saw firsthand how important our schools, public and private, are to our families, to our communities, and to our economy. And of course we know it's what's best for our learners. So our goal, as you've heard today, our priority goals are to ensure that our children return to school and are able to stay there for as many days as possible throughout this fall and the remainder of the 21-22 school year. And we'll do that by increasing and promoting our efforts to vaccinate as many people in our communities as we can, following the CDC guidelines and the K-12 return to school guidelines as they have been outlined here today. And I am confident that you have the will and the determination and the best interest of your students in mind as our schools, districts, and communities return to a very successful, healthy, and productive school year. Thank you.
I want to thank our education leaders, our Lieutenant Governor who's here, for their hard work. Also, they both made a really good point. We already know this works. We already know this works to stop the spread of COVID, and this will keep it from spreading in schools. I know there'll be those that aside from just wanting to do the arguing, there'll be some that say, but I've gotten vaccinated and my kids have gotten vaccinated. I mean, come on. And what I'd say to them is, I understand that frustration, but remember, the person that we're trying to protect, the one that may be sitting next to your kid, is another kid, is another child. And we got to make sure that we do the right thing by our kids and everybody else's kids too. As responsible adults, we owe a duty to all children of Kentucky, and that is whether or not those kids have gotten vaccinated or are even eligible to get vaccinated. So with that, we'll turn it over to Dr. Stack, who's got several different things to talk about, including a testing program that is going to go live today that school systems can use.
Thank you, Governor. And let me just please reiterate our partnership with the school community. It's been a long road. It's been a long road for all of us. But these partnerships, and I've celebrated this before, whether it be with the schools, whether it be with the Kentucky Department for Education, the superintendents, the administrators, or business community, or with the hospital leadership, the medical profession, the nursing profession, city and local leaders, local health department leaders. We have had partnerships through this whole journey, and it's what's helped Kentucky way outperform what anyone would have predicted based on our overall health status and where we started from. So we will get through this. We'll get through this together, but it will take all of us to get through this. I do have a few additional messages that I want to add, and I'll use, if I could, the first slide, Kenneth. This is not for the general public. This is for superintendents. This is for school administrators, principals. On our website today by 5 o'clock when we do the daily update, right in the middle of the first page is a education tile. If you click on the link down there, it'll take you directly to the page for this. We've been given $134 million by the federal government to create a testing program for K-12 schools, public and private, throughout the entire Commonwealth. There are 13 laboratory service providers who have signed up, who've gone through the proposals and been approved, and they are all up there. We were getting a few straggler information in there, but they should all be up there. You can search by county and find the vendors who are approved for you. Lower down on the page, there is another group called Affinity. They have directly contracted with the federal government. The feds have done a regional approach for this. That is a different model, and it's all of this, whether you go through the state program or the federal one, is all paid for by federal dollars for COVID relief. So I urge you, everyone who operates a school out there, please go to the website tonight, tomorrow morning, explore your options, find a testing provider, and make testing available to your students and to your faculty and employees. It's all employees and your students. Please do this so that you can have access to testing throughout the school year to keep yourself safe and in classrooms as much as possible while being safe. If we can go to the next slide, please, Kenneth. I'm just going to leave this up here while I share some other points. The governor asked me to just update a little bit on where we've gone. Since roughly the beginning of July, the number or the positivity rate has roughly quintupled, multiplied by a factor of 5. From the beginning of July, the number of cases has roughly quintupled increased by a factor of 5. You see that really steep growth here on the far right. It looks small because Mount Everest is to the left. The problem is we could exceed Mount Everest if this keeps up at this pace. The other things are that hospitalizations, intensive care unit admissions, and ventilator usage have all tripled since the beginning of July. I had a call last week with hospital chief medical officers and chief executive officers and urged them to please be vigilant, to make sure they monitor their PPE supplies, to make sure that they adjust their patient admissions and surgeries and procedures to preserve capacity when they need to, and to work with the hospitals nearby so that regions work together as a unit to coordinate their efforts and their resources. Here's a time when an ounce of prevention could be worth many pounds of cure. Hospitals in some of the southern states are already bulging at the seams and struggling to keep up. And remember, our poor doctors and nurses and therapists and pharmacists, they're exhausted from this because, tragically, this is a vaccine manageable condition. This should not be happening now because at this point, there is more than enough vaccine for every eligible American to have already been vaccinated. And so from the perspective of those healers on whom we rely, this is entirely a preventable tragedy, and it is very frustrating to be in their shoes. The Delta variant itself, the news we get on this, perhaps viral loads 1,000 times higher than the earlier variants. This is a thoroughly weaponized pathogen, 2.5 more times or so transmissible between people, and 1.5 times or so higher reinfection risk. All those who think you have natural immunity, you don't. If you got infected and it was 6 months ago and you think you're bulletproof, you're not. This virus is reinfecting people at a much higher rate than the previous versions. Even if you've had COVID, you should get vaccinated. Those high viral loads too, remember 1,000-fold higher, that's not trivial, that's huge. We don't know what they'll do to people. There's already anecdotal stories about younger people being a higher proportion of the hospitalizations. And let me just tell you, science is amazing and the things we can do for healthcare is remarkable. The fact, though, that we can put cannulas in your big blood vessels and give you oxygen through your veins and your arteries may be something we can do to keep you alive. It is not something you ever want to experience. People lose hands and feet and are permanently impaired, and nobody goes straight home after that. You all go to a long-term care nursing home to try to recover from that. So, folks, just because there's amazing science out there in medicine and there's great healers using it does not mean you want to take this lightly. This thing will go through, I hate to use the wildfire analogy, but that's exactly what it'll do. If it gets in somewhere, it's going to spread way faster than last year, and it was pretty bad last year. Hospitals, I already said, are bulging in the southern states, and overwhelmingly, this is a problem in an unvaccinated community, much, much, much more so than a vaccinated community. I would sure hope we would all want to celebrate more birthdays than funerals, but unfortunately a lot of people are choosing more funerals over birthdays. It's a tragedy because it does not need to happen. Last year we were nearly powerless to be more refined in our approach. This year we have a very refined tool. If we could put the last slide up, Kenneth. Just a few words about these vaccines. I've shown this before. We update it week over week. The left bars are gray. Those are unvaccinated persons. The blue bars are vaccinated persons. In June, it was a 6-to-1 ratio, 6 times more people unvaccinated who tested positive than vaccinated. In July, it's about 5 times, give or take. I'm rounding here. But what you see is the growth is happening in both, but the protection of the vaccine is staying intact. These vaccines are safe, and let me be very, very clear. There is no debate here. There's no two sides of the story here. There is fact and there is fallacy. The folks who are peddling in falsehoods that these vaccines damage your fertility, they do not damage your fertility. That there are magnets in them, that is utter rubbish. There are no magnets in these vaccines. That they do anything other than amplify your immune system to protect you from vaccines, those persons peddling in that falsehood are killing people, and it is a tragedy. These vaccines work, they are safe. We've deployed them on 1.4 billion or more humans across the planet Earth, and overwhelmingly they have done nothing more than protect folks. And let me be clear, life is full of risks. There is no free lunch, Yes, every now and then someone has an infrequent or rare occurrence, and those are sad whenever they happen. But if that's how you live your life, you should never get in an automobile, because you are far more likely to die when you drive home from wherever you are today than you are to ever do any of these other things. So these vaccines work. Now I want to urge you all, I am not here to instill fear. Life is full of choices, but don't be like the knight in Indiana Jones where they say he chose poorly or she chose poorly. This is one of those things where when you're looking up at the ceiling in an intensive care unit with every orifice in your body filled with a tube, that is a sad and tragic time to wake up and realize, oh my gosh, if I had just gotten that vaccine, I wouldn't be here right now. Folks, please get vaccinated, and for all the rest of you who have gotten vaccinated and are concerned, this is very different this year. If you get vaccinated, you are far safer. If you still have concerns, wear a mask. If you're still concerned, stay away from crowded indoor spaces. If you're outdoors casually passing people and you're vaccinated, you're in good shape. We do have to get on with our lives. We can't be held hostage by this virus. That doesn't mean we have to be foolish and reckless and ignore the gift we have of our intelligence to make wise choices. If you get vaccinated and you act with a bit of a fair and reasonable judgment, we can all be safe and get through this. And let's hope for everyone else who's not vaccinated, please go get vaccinated. No one's depriving you access. In fact, I think the rest of society is tired of begging you to take this protection. But when we see these harms, they're going to come for you, and you're the ones who are going to get hit. So I urge you to get vaccinated. Thank you.
Man, Dr. Stack fired up today. And an Indiana Jones reference. That's The Last Crusade. That's referenced there, not the newer one. Not the newer one. But in all seriousness, you get why he's fired up, right? Because we have the answer to the entire pandemic, and it's in vaccines. The answer to the entire pandemic is in any drugstore, any grocery store, any local health department, and all you got to do is go and get it. And we also know the answer to how to keep this from spreading in schools and how to make sure we maximize the number of days that we have in-person learning. My kids are going to follow these, and I think that it's not too much to ask our kids to adapt really quickly. The question is whether we as adults are going to try to get in the way of doing the right things for them. But these recommendations are as clear as they can be. We wanted to make sure that there was no room for debate in what we as the state, as well as KDE, believe is the right move for school districts to make. With that, we will open it up to questions. To the extent people are willing, let's try to keep it on this topic. Thursday, we have a Team Kentucky update, and we'll answer anything at that point. So I'm going to go through the order I have. We'll get to everybody who has one. I know it's an important day. Tom, you RSVP'd first.
Thank you, Governor. And this is for Dr. Stack, so you want to bring him back up. Dr. Gottlieb on the Sunday television talk shows mentioned the fact that we may be seeing the peak of Delta, that Great Britain is starting to see it drop some, and that we're 3 or 4 weeks behind Great Britain on this. So I was wondering if you had seen anything along those lines, and if you had any thoughts on that, as well as what are your thoughts on the Cleveland Guardians?
Cleveland professional athletics cured me of any interest in professional sports as a young child, so I don't have any further comment on the Guardians. I grew up during the Cardiac Kids, and when Mike Hargrove was at first base, not the coach, and so it was a rough time as a child. But with respect to the Delta variant and peaks, I struggle. I'll be honest with you. I try to give a lot of data and interpret it and offer information. I do struggle a bit with some of the prognostications sometimes because, we're all living this going forward. So I don't think we exactly know until we get enough data somewhere else. So let's hope. I mean, Britain has one of the higher vaccination rates in the world for a whole nation. Let's hope then we have a quick spike and it goes down and this all dissipates. I would love for that to be the case. The problem is in Kentucky, 2.2 million people are still unvaccinated. I've said this for over a year. Small percentages of very big numbers are still big numbers. So just do some little math. If 1% of all the 2.2 million people got sick in the next 6 months, that's 22,000 hospitalizations if they all went in the hospital. It's big numbers. And so I think that we would be foolish to look to what's happening in Britain as a reason for optimism and look instead and say it's a vaccine preventable problem if we just get vaccinated.
Stu Johnson.
What will it take to increase vaccination rates? And I guess I'll add with that, unfortunately, will it take a high number of people getting very sick and dying from this before the vaccination rates go up?
The question is, what will it take to get vaccination rates up? If any of us knew that at this point, we would be out there doing it day in and day out. We've reached a tough point where we're slogging through it. I'm actually grateful that we're holding steady. You would expect more fall off every single week, and this last week we ticked up. I certainly think the Delta variant should be a wake-up call. Now, how many videos do we have to watch of somebody saying, I just wish I'd taken it, when they are horrifically sick? How many videos do we have to watch of parents talking about losing their kids or kids losing their parents that say, I begged them to take it? And then they're not going to be at the next holiday. I hope it doesn't take tragedy. I really hope that it doesn't, because, you know, those are families that I don't want to go through that. Even if they refuse to get vaccinated, I don't want them to be hurt. And that's why I keep begging folks to get vaccinated. And you could be our next millionaire. We're doing that drawing on Thursday. We're announcing it on Friday. You got to get vaccinated before the end of Wednesday and register to do it. 5 kids going to win a free higher education. So if you won't do it because it will save your life and stop some of the worst times that we've ever lived through, do it for the money. Debbie Yetter.
Dr. Stack mentioned that I think he said society's tired of begging people to get vaccinated. What more can you do? I mean, is this a moment where you tell people to quit being ridiculous and do it?
Well, I saw or have seen a number of governors that have lost their patience. I understand that. I understand. Kay Ivey brought the heat that day. I'm going to try not to do that. I can't promise. I'm going to try to be patient with everybody out there. Nobody wants to die. And there are folks that have been fed bad information by people that they unfortunately trust. My hope is that we will continue to stay steady, if not increase. And every day, I hope we find that next thing that will help people get vaccinated. One thing that does help, and you all do this, is providing as much factual information about the danger of the Delta variant, which means fact check anything that we say, but let's all continue to try to make sure people know what they could face if we don't get this right. Bruce?
Thank you, Governor. Will these recommendations become mandates to school districts if this surge continues to worsen?
So when we were in the beginning, when we had to take steps with schools, a mandate wasn't necessary. We believe these recommendations are so clear, the science is so clear, and the priority. I mean, my goodness, do we have a school district that's going to say they have a different priority other than as many in-person learning days? So our expectation would be that our school districts jump on board. Again, there's only one right answer that protects the kids. And if you have upset parents, your choice is upset the parents or protect the kids. And there's a whole lot more parents out there that get it and want their kids to be in class. Remember, if this was just vaccinations, any percentage of any class right now, based on the overall number of 12 to 17-year-olds vaccinated, could wipe out a class for in-person learning very, very quickly. Joe Ragusa.
This maybe a question for you and for Commissioner Glass as well, because I mean, you mentioned you don't want really this to be a political thing with schools, but we're already seeing with other areas that, you know, school board meetings and that sort of thing are becoming fairly political. Are you worried about there be this kind of adding to that, or even any burnout among district officials who are dealing with this kind of stuff and dealt with it last year as well, and are maybe just saying it's not worth it?
And my faith teaches me that doing the right thing is always hard. And this is a moment where we need the courage of some really great elected officials out there, superintendents, board members. We're not asking all that much when you look at keeping kids in school and protecting them. And we need the buy-in of those local school districts. This is going to work to its best and protect the maximum number of students if they truly buy in. And our educators, I mean, they really care about their kids. And every recommendation we've given is about the kids. And yes, that may mean that you got to go through some tough school board meetings, but if it's the right thing to do, that's what you signed up for. Drew Gardner.
The new testing portal that's available to the districts what is the recommendation right now as far as testing? Is it regular, weekly, daily?
We don't have a frequency out, but certainly if you are a school system, you want some monitoring, right? You want some monitoring. There could be asymptomatic cases or others. And our school districts vary widely in the number of individuals, the size of the schools. And so we want to empower superintendents and school boards to look at it. Certainly, the lower the vaccination rate in a county or an area, the more you may want to think about doing it. I will tell you that we had for about 2 weeks stopped our regular testing in the governor's office and the lieutenant governor's office. We're bringing it back. Now, I believe we're all vaccinated, but we want to know if we do have an outbreak, because we got lots of people that come in here, and we don't want to get anybody else sick, just like we'd like to know if we have it in general. Karen Czar.
Piggybacking on that, currently, if you are vaccinated and you know you've come in direct contact, but you have no symptoms, should you still go ahead and get tested?
So you should get tested, but as Dr. Stack was talking about today, you don't have to quarantine. So it's a big deal. If you think about you're in that class or you're that teacher and you're vaccinated and you're wearing a mask, just because there's a case in that classroom doesn't mean that you're not going to be back in school the next day. The more mitigation steps that are piled onto each other, the less tough the quarantine rules are. But you should, if you come in contact with somebody vaccinated or whether you're vaccinated or not, you should get a test. Remember, it's also the degrees of separation. If you come in direct contact with someone that you know is tested positive and was likely positive in that, yes. If somebody came into contact with somebody who came into contact with somebody who you saw yesterday and you're vaccinated, you're probably fine. Chad.
California now requiring state employees to either get vaccinated or be routinely tested. The VA sending out a similar requirement today. Have you had any thoughts of expanding any kind of requirements or mandates? And also, whether with that or the school guidance, do you worry about compliance, whether it be with students or parents, and what consequences could there even be?
I don't worry about compliance when it comes to our kids being in school. They showed us last year that they're willing to do what it takes to be in there with their friends and to get that learning. Kids aren't our issue. They're not our challenge and doing what's right. And you know what? They adapt so quickly. I still remember being amazed when my son was 2. He was with he ended up breaking his wrist, and watching him use his other hand as quickly as he did. I mean, our kids are amazing in what they can do. So no, I'm not concerned about that, and this protects everybody who works in the buildings too. So I don't see that being an issue. What was the first part of the question?
California is also issuing.
Yeah, so we're not there yet. However, I think that healthcare organizations should think very strongly about whether or not they mandate or don't mandate for their own groups. And I think they should continue to incentivize, because if you are in an area where you are at some of the highest risk, you want to be vaccinated. And I've already recommended, even if you are vaccinated, if you're in something like retail or restaurant, and they already do it in healthcare, you probably ought to have a mask on too, because the number of contacts that you have is just like back in the beginning we were talking about it, is the number of times you roll the dice, however small that percentage is. And so it can be better protection. Catherine Collins.
On the school guidance, can you talk about the reasoning in here of having, instead of just one recommendation that everyone be masked, having that other option that all unvaccinated students and adults be masked?
Well, we have the 3 steps, and 1 and 2 are connected, but I just wanted to be crystal clear that having a class of entirely unvaccinated children won't work in the Delta variant in any way, form, or fashion. That's why we have the second one up, even though it's part of the first. We believe that it's important to give the first recommendation because vaccines are the answers. And we don't want to back off from the fact that we think that the vaccine provides significant protection. The third, I want to know that school systems that opt to do that have our support. And it certainly would optimize the number of in-person days. So we wanted to give some level of flexibility while also being clear on risk, but what the minimum that we should be doing right now embodied in that very first. And I want to continue to encourage 12 to 17-year-olds to get vaccinated. If we had enough 12 to 17-year-olds to get vaccinated, we wouldn't have to do this, say, in high schools. Wouldn't have to. If virtually all were, this wouldn't be necessary. And if we can get there, it won't be anymore. And then we fully expect that there will be approval, though the dates are changing, for kids for certain amounts of kids under 12, probably all that would be school age. We expect that approval in the fall or in the winter. So again, we have the possibility of not having to do any of this anymore. And the answer is vaccines. Alex.
So I don't want to harp on this too much, but you present it as very black and white. You want to give school districts the option of heeding these recommendations, which are very clear. History tells us that districts will take different measures to mitigate spread.
Mm-hmm.
At what point does a mandate become necessary? Is an eventual mandate off the table?
No, it's not off the table. Now, I've said I'm going to have the courage to do what's necessary depending on the conditions on the ground. We think that we are going to see enough results to where that is not necessary. Institutions, and we now know the facts on. We are seeing out of control spread in our school. Responding, but pointing that out. I mean, whenever we've had an outbreak in a they've done it. Even leading up to it, they've done the right things. But no, when it comes to the health of our people, that's not KDE. I know they have different legal. Melissa.
So can all take a different approach to assess which schools, which ones have not, and are and is that in motion?
Conversations start, especially between KDE and ongoing, but I know that they will. We're going to look at what's necessary as far as. But again, we're in a different place, especially if they have to notify the local health department. So we have a put it together. We're not there yet, but to take them. Kevin, I saw you joined us.
So you have the unvaccinated students and the vaccinated adults. How do you suggest that school districts?
So the question is vaccinated? The answer is no, because if you got masks, you're going to have the Delta variant. Check to see whether you're vaccinated or not. The fact is, with real consequences. Works, and no, you don't have to ask for anybody's card up. If you're unvaccinated, you have to wear a mask, and there's an outbreak. Trouble.
boy, when this job is over, it would be nice. So the challenge is that some zip codes span counties, and so Spencer, federal facilities don't have vaccinated for the whole state, but we don't know. So federal prisons, federal military bases, VAs, we don't know where they vaccinate. And so they have more people there. So Christian and Spencer are higher than they currently show. Badly we don't, and there's not, we have an IT ticket in, is it? So we're working on that, but but what I would say is it would not be high. Okay, so if tool, they still would not be.
But it's going to take the federal government is constant, and it outstripped ours. And that's one. All right, anybody else have a follow-up?
Fight in Kentucky and how much of it you're actually able to.
What we can test for is very small, under 4%.
It's
A little under 5%. The newest breakdown on variant is jumping up very quickly in percentages. Have the overall numbers, but at this point, assume Delta variant. That's why we don't get too caught up on the what this thing is.
Do you have educators that are vaccinated? 17-year-olds, you're not given a percentage on. Is there a reason for that?
The challenge is getting the right demographic data on the denominator, on the overall number of Kentuckians that fall into that area. Right now, we've seen 3 or 4 different numbers on what that is that would create different percentages. Hopefully, if the census numbers ever come out, which I keep getting asked about other things with that, then that'll give us the right denominator on that.
Is there any additional guidance for KHSAA activities?
Lieutenant Governor, you want to? So as you know, Lieutenant Governor is our resident educator and coach.
I have to tell you, you all lasted way longer than I thought you would before you asked a sports question. Actually, Board Chair Young and I had a call with Commissioner Tackett this morning at the KHSAA, and I am happy to report that after speaking with Commissioner Tackett that we are all singing from the same sheet of music. We're all looking to the CDC for guidance, as we should be, and following that protocol in the way that the CDC rolls it out. You know, I think about talking to Commissioner Tackett this morning and thinking about the demographic of folks that they have the ability to reach that maybe we don't reach here at 4 p.m. with athletic directors and coaches and kids and their families. And so it's my hope that our athletic community it leads in this, because it's really important to make sure that not only do we get our kids in school and keep them there, but we give them, we make sure that they have the opportunities that we want them to have as student athletes. Commissioner Tackett shared with me today that 25% of football and basketball games, high school football and basketball games last season were lost. Now, if I'm a kid, that's a quarter of my season. If I'm a family member, that's that many chances I missed to be able to watch my kid. If I'm an athletic director, that's a quarter of my revenue, right? And so there is a collective interest in us making sure that we do the right thing, not just for ourselves, but for our teammates, because that's what it means to be a good teammate, and that's what we do here on Team Kentucky. So that's an athletics update.
I think as we're seeing with the NFL or the SEC, you know, or really our workforce, COVID in one sense isn't red or blue, it's green. It's lost revenue. It's lost revenue for those sports. It's lost revenue for our businesses as well. Just think, If we don't do schools right and kids have to be home for 2 weeks, where are their parents going to be? Right? You're going to get lost productivity and right now a workforce that we need to add to. And so from a private sector side, they need our kids in person every day in school so that we can have multiple working parents that are coming into these great new jobs that we're creating. Yeah, Kevin.
Is there anything, I know the Delta variant is so new, that there's anything to suggest that this strain of the virus is more contagious among children? I mean, it seems like, based on some of the CDC guidance, it was more concerned staff to staff or that sort of thing. Is there anything that would suggest that this is something that could be driven by students?
There are certainly things that suggest it spreads more aggressively to everyone and therefore would include children. One thing, though, is that children don't get tested as much, and with the early versions of COVID, they didn't get sick or sick at all, which is changing. And so, how many kids may have had it before versus how many we're seeing now? It's hard to gauge. The other thing that's happening right now is our seniors are so protected that then changes when we put out cases in the age groups. And so it's really, like we talked about before, a really aggressive variant and a really effective vaccine. And what happens when the two hit? It goes to the unvaccinated, and more children unvaccinated than any other group. So we would expect to see more. But it does seem to be, from the cluster report, it does seem to be spreading amongst youth activities. And we're seeing that more. I'm seeing that more, though that all depends on what local health departments send us than before, when you would look at a lot of adult activities. Karen?
Some of the teachers I've talked to said they're concerned about becoming the mask police going into the school year. Could you talk directly right now to educators who are getting ready to go into the classroom in about 2 weeks?
Well, to our educators, I think we have made very strong and clear recommendations for the safety of the children in your classroom as well as the staff. If school districts put these into effect, there's no gray area. It's required either for unvaccinated or for everyone, and that ought to take the pressure off the educators themselves. When there are clear rules, you see more follow them, and we already proved that we can do this. I mean, we showed that you can stay in school in a pandemic if you wear a mask. All right. Thank you all very much.
Really, outside of New England, we've had a relatively benign course for this virus nationwide. And I think the one size